Hello, everyone. This is Roja Perumandla. I'm currently working as the Director of Professional Services in a population health management organization. I've been in the technology industry since past 16 years, playing various roles in areas like business intelligence, product management, software delivery, and implementations. Today, I would like to focus on how SMS-based solution is revolutionizing healthcare population management industry. We will go through some gaps that current population healthcare management industry has and how SMS-based solution is designed to bridge these gaps through intelligent message routing and event-driven architecture. This framework, we will also learn today how it enables healthcare organizations to deliver personalized, clinical relevant communications that improve the outcomes in value based care environments. So let's deep dive. The major gaps today in healthcare population management are treatment plan adherence gaps. This is where healthcare organizations are struggling with low patient compliance to prescribed care plans. Targeted digital communications have shown a significant boost in adherence and reduction in missed opportunities for appointments and decrease in hospital readmissions. Next is patient engagement challenges. Traditional outreach methods often fail to maintain consistent patient engagement. Strategic digital communication approaches have enabled higher satisfaction scores and also engagement levels, leading to improved care continuity. Sometimes the medication compliance deficits are also a major gaps in this industry. Non-adherence to medication regimens represents a critical gap in effective population health management. Structured digital check-ins and personalized protocols have achieved major improvement in medication compliance among previously non-adherent patients. And the last one is about the social determinants barriers. Healthcare systems often lack effective mechanisms to address non medical factors affecting healthcare outcomes. Digital outreach strategies have shown a significant improvement in connecting vulnerable patients with essential community resources for food, transportation, and housing needs, almost up to 35%. There are critical gaps in population health management today that we just discussed, and how patients struggle with complex treatment protocols, leading to poor outcomes and increased hospitalizations. The missed appointments create discontinuity of care and prevent timely interventions. So, the SMS based solutions provide a healthcare specific technical infrastructure which addresses these gaps through seamless EHR integrations. This is HIPAA compliant system and it also utilizes HL7 FHIR interfaces to enable automated care gap identification and clinical data exchange, ensuring that there is an alignment in a member population and healthcare industry. Let's try to understand why SMS is an important framework for healthcare population management. Today, healthcare population and healthcare organizations face significant population health challenges, including inconsistent treatment adherence and high appointment no-show rates, which are preventable hospitable readmissions. But the delay in care gap closure is what is the biggest challenge. Traditional outcome methods reach only 38% of patients within 24 hours, creating critical delays in time sensitive interventions. Population health management faces some other critical gaps, like how we just understood, which are communication delays, fragmented care coordination, inconsistent patient engagement, and limited monitoring between visits. An effective SMS platform will address these challenges through specialized architecture. Let's look at how this architecture on a high level is. The healthcare integration layer, which is comprises of healthcare and HL7 and FHIR interfaces, and also provides a quality reporting systems. The next layer comes into a clinical message processing engine. then protected health information database, and then healthcare compliance layer. This SMS technology and framework also helps in addressing chronic disease management among the population health. Population health management currently is facing continuous monitoring gaps, medication adherence, and timely intervention. For diabetes management, if we take, for example, the system of SMS technology implements structured pathways aligned with American Diabetes Association guidelines, providing blood glucose monitoring prompts and adherence support to address these critical care continuity gaps within the patients. Let's look into some care transition management opportunities. The critical gaps in population health management include inadequate discharge support, missed follow up appointments, medication errors, and insufficient post discharge monitoring, which is especially affecting patients with limited health literacy. SMS technology helps with discharge instruction reinforcement by sequencing the messages following evidence based transitional care models. SMS can also be used to send out follow up appointment coordination, which is like an automated reminders with preparation instructions. SMS can also be utilized in medication reconciliation support with structured check ins to verify understanding and adherence of medications by the patients. SMS can also be utilized in post discharge monitoring, where symptoms assessment with an alert threshold, sending out alerts of what kind of symptoms that our patients are encountering and what should be the next steps can be monitored and sent out. The alerts can be sent out with the SMS. Thus, SMS can play a major role in preventative care and screening. Let's understand some of the popular ways and significant areas. The significant gaps exist in population healthcare and delivery, which is creating opportunities for systematic improvement through structured interventions. One of the such areas is low screening completion rates. Traditional reminder systems fail to account for individual risk factors, resulting in missed cancer detection opportunities and preventable late stage diagnosis. Conventional immunization outreach methods achieve inadequate population coverage, leaving vulnerable groups susceptible to preventable diseases. Lack of pre-visit preparation leads to missed care opportunities, with providers struggling to address multiple preventative needs during time-constrained encounters. The systematic approach of SMS-based solution addresses these gaps through targeted interventions. For example, risk stratified cancer screening, structured immunization management, and enhanced wellness visit coordination. In all of such targeted intervention areas, SMS can play a major role with how we can align the proactive outreach with prerequisite guidance and also which also increases the care gap continuancy. Let's look into some more gaps in population health management where SMS technology has addressed challenges and also in social determinants of health effectively, which has created opportunities for technology driven solutions. Today, major portion, almost up until 75% of healthcare organizations report significant barriers in coordinating care across multiple providers and community resources, resulting in duplicate efforts and missed intervention opportunities. There are access disparities where vulnerable populations face higher barriers to accessing preventative services with transportation limitations and inflexible appointment systems, which are disproportionately affecting rural and low income communities. Communication breakdowns. Traditional communication channels reach only up to 62% of high risk patients today, with one way messaging failing to provide actionable insights into patient circumstances between clinical encounters. Clinical decisions are made with incomplete information, and where social determinant factors are impacting health outcomes remain undocumented in a traditional EHR systems. Addressing these gaps requires an integrated technology approaches And an SMS-based technology and framework is a right way to address these key and gaps and has shown with significant statistics and improvement. Let's look at some more healthcare gaps that SMS technology has addressed. There are some strategic communication approaches where these gaps have been bridged, and let's look at them. Limited patient engagement. Many patients, particularly those in underserved communities, remain disconnected from their care team between visits, resulting missed opportunities for early intervention. Having that patient or a member in a rural setting have a continuous engagement with the patient care system, the team, and SMS is at least cost effective, yet that which can bridge this gap that we have spoken about, the critical gaps. Inconsistent care protocol adherence. Without structured communication systems, care teams are today struggling to consistently apply evidence based protocols across diverse populations. In accessing the access disparities for the member population, SMS technology has bridged major gaps and barriers for underserved and rural populations with limited healthcare access. Care continuity, where the structured communication pathways address fragmentation in post discharge and chronic condition management, that has taken leaps and bounds of improvement and has bridged the gap. Healthcare literacy. Tailored messaging frameworks overcome educational and language barriers that impact health outcomes. For implementation of support and additional resources, these patients can always contact these care teams of how to improve in their healthcare outcomes and disparities using SMS technology. Thank you.